Okay. Dr. Mohammed, when you're ready, let us know.
Yes, doctor.
Okay. Just a minute. Okay, so I'll start the timer now. The people who are listening, please actively listen, okay? We need to have a good feedback from you.
Hello, good morning.
Hello.
I'm Dr. Hussain, one of the doctors in this department. From my notes, I can see that you are here to talk about your mother.
Yes, doctor.
All right. Could you please confirm her name and age for me?
Yes, doctor. She's Mrs. Blake and she's 85.
All right. And can I please confirm your name as well?
Uh, yes, doctor. I am Angela.
Okay. So yes, Angela, how can I help you today?
Well, doctor, I just want to came here to talk about my mother. I just want to know what is happening.
Mm-hmm. All right. Um, so yes, your mother is has been sent for an X-ray. So meanwhile, I just want to ask you some questions. So, what do you know about your mother? What happened to her?
Um, I know that she had some fall and stuff, so she was brought to the hospital. That's it. She was
Mhm.
actually walking and she fell on the radiator.
Okay, all right. And when did this happen?
Yeah, it was like in the morning.
Okay. Was anyone there with her when this happened?
No.
Okay. And what did you do after the fall?
Yeah, so I just brought her to the hospital.
Okay. And where did your mother hurt herself?
I don't know really what happened.
Mhm. Okay. Uh, is this the first time that she is getting hurt?
Yeah, she had like fallen before also.
All right. Could you recall like as to why she's having such frequent falls?
I don't know. I think she just falls on her own. I don't know what happened.
Okay, all right. Apart from this, does your mother have anything else?
No, nothing else.
Okay. Did she hurt her head by any chance?
Sorry, doctor, I had to unmute.
Yes. Did she hurt herself by any chance?
Uh, no, she didn't.
Okay. All right. Is she having any medical conditions?
No, she's not.
Okay. Is she taking any regular medications?
No.
All right, that's good. And how's her health in general?
It's fine.
All right. Okay. And I just want to ask some questions about her social history. So, who all lives in your house?
Me and my kids and their grandmother.
Okay. And how's your relationship with your mother, and how's the kids' relationship with their grandmother?
Uh, yeah, like I think it's fine. I mean, I am very busy. I get very less
Mm-hmm.
time to spend with her because I have to handle all the finances of my house. But my kids are well.
Right. Okay, that's good to know. Okay, so um, I just noticed something. Like it is um, the injuries that your mother has faced. So it looks like, there has been like multiple falls, or like she had multiple hurt. Am I right?
Uh, I don't know, doctor. I'm not sure about that.
Mm-hmm. Okay, so uh, there was also some bruises on her, which looked like, it doesn't match with what you have exactly told me, like that she had a fall. So, is there something that is going on?
What are you trying to say, doctor? I didn't understand that.
Um, from our assessment, it looks like, that her falls, they have been happening very frequently. Like she's getting hurt very frequently, and is there anything that we need to know about, like as to how is this happening to her?
I don't know. I told you I don't know why is it happening. I told you already.
Mm-hmm. All right. Okay. Um, does she have any memory problems or anything? Any learning problems?
No.
Okay. Um, so Angela, I just wanted to ask you that it's okay. You can tell us if there is anything that is bothering you or anything like that. This is a safe space.
2 minutes remaining.
Nothing
Because
is bothering me, doctor. I just like it's like you understand. No, I am alone taking care. I don't have any
Mhm.
partner. I have to take care of
Right.
my whole family and everybody. So it does impact me. It's not easy for me as a single woman, but I am trying my
Right,
best.
Angela. Yeah, I know it's really hard for you being the sole breadwinner of the house. It must be really hard for you to manage everything. But at this moment, we are really concerned about your mother, and it looks more like these injuries. They don't match with the history that you have given us. So I just wanted to know if there is anything else to it. You can talk to us. We will try to help you as much as we can.
No, no, no. There is nothing else. What are you trying to say? I don't understand. What are you thinking? Can you tell me?
Is it any I?
What do you what do
Okay.
you mean it's an AI, doctor? I don't understand this.
Okay.
What are you
Um,
trying to do for her? What are your plans?
so basically now we have sent her for an X-ray. We are going to admit her,
Mm-hmm.
and we are going to do some further tests.
Okay.
Okay, we might have to do a CT scan to rule out if there is any injury to her head. We might do some routine blood investigations
Okay.
to check for any kidney function test or any liver function tests,
Okay.
and urine electrolytes.
Mm-hmm.
And right, and I'll also involve my senior,
Okay.
right,
What else?
and yes, and we'll be keeping her for observation in the hospital.
Okay. Who else will you involve?
um, we'll also
Move
involve
on to the next station.
All right. Okay, Dr. Mohammed, what do you think?
um, I haven't done this station, so I was thinking, is it a non-accidental injury?
You haven't done this station? Like, what do you mean? It's a very common
Like,
station.
yeah, so I didn't know about this. Was it a non-accidental injury, or was it a different case?
Yeah, so see, if you haven't done this session, that's even good. So that means you're not scripted. So the examination on the station, it's mentioned there are multiple bruises of different ages on her body, which means that she's been falling frequently. So, but you are not,
Mhm.
of course, you are not sure it's NAI. So NAI is one of the differentials, all right. But what are the other differentials? Have you ruled out all of them? It's
Mm,
not about whether it's NAI or not, whether you reach the diagnosis, whether your approach is right. That is a more important thing. Did you rule out all the things? What are the causes of falls?
yeah, I didn't do that.
Okay, so what do you think? What did you do in this station, which for which you will get marks?
basically you have to rule out all the DDs, any if she's having any dementia, if she's on any medications, or any thyroid issues, or old age issues, or any problem with her vision. Maybe
Okay.
she's not able to see, so she's having falls.
All right. Okay.
Okay, yeah.
Okay, so let's take feedback from the people who have been listening. Please give some valuable feedback. Whatever you learned from him, whatever you think he should learn from you, or he did something wrong, please come forward.
Actually, the red flags. Hello.
Yeah.
Yeah, in the red flags, actually, he should ask some questions regarding like how she's fell down, like about the floor. Is it slippery? Is she able to hear properly? And about her, like, is she independent, mobile? This question we can ask in the red flags. I think so.
Okay, so basically you're saying causes of falls, right?
Yes, yes, yes. That one thing.
Yeah,
That's good. Anybody else?
I think the causes of falls, I think, should have been ruled out because she's an oldest woman. It could be like her heart problem. It could be a some medical cause of the fall or a non-medical cause of fall that should have been explored. But then I think after ruling that out, main emphasis should have been on the social history. Like we see, the female is saying that she works the whole day. So we could have asked her, like, is there anyone else who comes at the home, just to know more about the social history, because it's a very high chance that it could be a case of NAI. So we don't know, like, who else comes behind her. Plus, she's so old. We could have asked that, is there any package of carer with her, like any carer, any point of care that he's getting from the NHS or something like that, just to know what's the social condition there.
Okay. All right, Dr. Esas, thank you. So you told us that social history was missing and any care she is getting. What else? What is the first point you told?
You're basically ruling out the medical and non-medical causes of the fall.
So
Plus,
causes
I
of
think
fall.
the metabolic causes.
Okay.
Yep.
Causes of falls. All right. Anybody else?
Yeah, the stations are mentioned. It should avoid like confronting the patient's carer. Like the doctor kept asking, like, is there something you're not telling me, or tell us it's a free space, safe space. Rather, I can try to ask in a more better way. Try to gather data gathering should be more to be without sounding confrontational, and like the differential should have been more like ask the patient if they are on drugs, if they have mental capacity is okay, if they are falling on accident, or if the people that come to take care of her are, is there any harm, and ask about the support system in the house itself, if the house is carpeted, if the toilets have railings, and if she's able to move freely, and also if she has any social service people that help that come and take care of her. Yeah, and for the management part, you have to involve, you try to ask about that you tell the patient that you're going to involve social services. Yeah.
Okay. All right. Okay. So whatever you mentioned, differentials, that's good. Social services, yeah, that was not mentioned at all. And what are support systems? Okay, thank you. Anybody else?
Dr. Ruchit,
so he could have mentioned more about the previous falls, like how was it happened during the previous times. So what did they do for that? Like how was it managed? So better we can insert that in the management.
Okay, all right. Anybody else?
And a little bit about the medical conditions, like any bone diseases or like any osteoporosis or any.
Okay, yeah, that will DEXA scan and stuff has to be done. Okay.
Dr. Ruchit.
The blood tests were like explained in a bit detail. I think more important than that would have been a bone
Your voice
scan
is
and
crackling.
survey.
Dr. Esas, you're speaking?
Oh.
Your voice is crackling.
Yes. Is it correct now?
No, it's crackling. It's like, somebody is busting crackers in your house.
Is it better now?
It's cracking. Can you just text us in the chat?
Yeah, okay.
Okay.
Yeah,
Anybody else?
sure.
Dr. Ruchit, I want to ask you, in any cases of non-accidental injury, sometimes like this elderly abuse case, okay? Are you listening?
Yeah.
So in this, there is no need like if the patient like open up or no, he didn't open. So this is not we should not worry about that, right? And we should not insist or force her to open up like did you do or something happened, right? I'm right.
See, NAI is, you never tell that you are suspecting NAI unless like the patient. See, you never mention about NAI because you are also not sure. If you are totally sure it's NAI, then of course that is the work of police, right? Police will tell. You are a doctor, you are not a police. So your work is to rule out the medical causes. And when it comes to the management, you will involve social services, and the patient will say, why involving social services? Then you will tell that, we involve social services because it's although you're a very caring daughter and doing your best, I can understand you're going through a lot, but we need to make sure that your mother is fine, so we need to ensure that nobody is harming her in any way, and also social services will help you in taking care of your family. So basically indirectly we never say that your mother is being abused. I did mock with one of the doctors who failed the station just because she said that your mother, same station, she said that your mother is being abused or somebody is abusing your mother. So never directly say it, indirectly say it. Okay.
So we can't say like this is some rough time going between you and your mother. I think like this is a abuse or something like
No,
that.
no,
No.
no, don't talk like that. If you talk like that, you just fail that session. You will say that social services have to be involved because we want to make sure that nobody is harming your mother. You never say, even if you know that daughter is harming, you will never say that daughter is harming. You will indirectly say that you are a very caring daughter and stuff. There is another scenario of the same in which the daughter will say that I pushed my mother. Okay, same alternative of this. So in that also you will, you will just say that it's like you won't blame her for the past falls and stuff. You will just provide her support, and you will again appreciate her for her honesty. So always appreciate the patient, never blame them. That is the work of police and social services, to find the person who is to be blamed. You as a doctor, you are not going to do all those things.
Perfect. Thanks very much. It's very good information.
Okay, anybody else?
Dr. Ruchit, one quick question. Like
Yeah.
the ending of the station, like is it okay to ask, like I realize that you are doing your maximum for your family. Like, people, when they are overwhelmed with a kind of work stress or anything, they tend to behave they in out of their character. So does that apply to you? So
No, no,
is it
no. Don't say
question?
like that. Don't say like that. So indirectly you are saying that your daughter is, abusing.
Mhm.
So don't bring that thing up. Like I already told, uh, you can say that, well, you are a very caring daughter. I can understand it's very difficult for you to manage. Are you getting enough support? Do you think you need more support? But don't say that, you're too much, busy and stuff. So sometimes people get nasty or aggressive in these situations or get angry. Is this something that is happening to you? Don't say like that. You will then you're blaming the, what, even if she says yes, what will you do else? Other than that, whatever management is there, you can't say anything other than that. Even if you able to manage to blame her, okay, you are the person who is abusing, what else? So what will you do extra in the station? Nothing. You will again say will involve social service. You cannot say that police will come and take you away. You will just say social services will come. So don't go out of your way, just mention what is important, social services, because you are still not sure, right? You are not, you
Yeah.
are suspecting it's NA. You don't know the daughter is abusing, like somebody told, maybe somebody else is coming in the house when daughter is not there. So you are not sure, you're suspecting one of the one of the differentials of falls is NAI. So that is just you as a doctor, you're suspecting it. So you're involving social services to make sure that social services will find out whether NAI is the cause or not. But you can never for sure say that it is the cause. So you can just say that we are suspecting it could be the cause. So, but we are not blaming anyone. We don't know. So you can say like that. Anyone else
All
wants
right,
to?
Dr. Ruchit.
Okay. Anybody else? Okay. So most of the points have been discussed for this station, NEI. We have got one of the comments from Dr. Essas, who was trying hard to speak on the mic. Mention of bone scan, skeletal survey should have been mentioned. Yeah, that's right. And okay, so so how we approach this station? So the doctor was not really understanding what he has to do. As a daughter, I was simulating in a way that, something happened, she fell down, I brought her. I may be little bit anxious, like, because I know within myself that I have done this, but or I may be trying to act like very, some people, if they have done something wrong, they will act like, nothing happened, they haven't done anything wrong, so they will simulate like this. So I was trying to simulate like nothing happened, I didn't do anything, she's just been falling. So as a doctor, he had to find out what is happening. So he was trying to, because he had this assumption in his mind that that people are, somebody is abusing her. That's the where the problem happened. So he was just trying to hit that thing, but that's not the right way to approach. So in this case, you have to find out what are the causes of fall. So first of all, explore the present fall, why it happened, when it happened, what was she doing before that, during fall, after fall. So every fall and seizure, same before, past, and during, what happened. So you will ask, before that, was she having any fever, any headaches, any weakness in any part of the body? During the fall, by any chance, did she lose consciousness? Did anybody see you? Did she have any fits? Did she pass, any urine in her pants or undergarments, whatever? And after fall, did she hurt herself? Was she drowsy? All these things you need to ask. Then non-medical causes of falls: was the floor slippery, any light problems, any vision problems? All these things you need to ask. Medical causes are any atrial fibrillation, any, like Stock Sudden syndrome, or she getting suddenly losing consciousness, any heart racing, or, missing beats. So you can ask that, does she turn pale sometimes? All these things. Does she have any memory problems? Dementia can also lead to recurrent falls. All right. Then postural hypotension. All these things can lead to falls. Then history of bruise. So bruise is there. So we have to take history of bruise. Is she taking any blood thinners? Is she on any steroids? All these things you need to ask her. Then of course you need to ask her any idea why it's happening. She won't say anything. That's fine. You ask about NAI history. So you are suspecting NAI. So NAI history has to be taken. So how NAI history, who is taking care of her? How is the relationship between you? If you are not there, how who is taking care of her in your absence? Does she go anywhere else by any chance? Is anybody with her when you are not around? So all these questions had to be asked. Then psychosocial history, because a mother, I know the people will, many students will be wondering, how can we ask so many questions in this case? Well, you have to ask these questions, because otherwise, of course, in the management, there won't be much in this. So mainly it's the history taking. Management is just short. So other than that, you will ask psychosocial history of the mother itself, like, I mean, of the daughter. She is coping up. Are you getting enough support? All right. So what, are you financially fine? And do you need any support with that? So all these things. So psychosocial history of the daughter has to be taken. Then, yeah, general meftosa can be done for the mother. Then it comes to the examination. So examination, it's already mentioned that she's having bruises and stuff. So you just say, we examined her, we found out that there are bruises and stuff. Do you have any idea why she could have got that? No. Okay. So, well, Angela, thank you so much. First of all, let me tell you that you're a very caring daughter. You have brought her to the hospital. This shows that you care for your mother. Of course, she cares for her mother. If she really didn't care, she wouldn't bring. Even if she pushing her mother, she still have a soft heart somewhere. She cares for her. So we have to appreciate that. Okay. So for talking about a further management, so we will be doing her X-rays and stuff, skeletal survey. We'll keep her in the hospital for observation. We'll do her CT scan. The whole bone scan will be done. Okay, will be done ECG, blood test, everything to rule out other causes of falls. All right, are you with me so far? Okay, doctor, that's fine, thank you. And also will involve the social services. So this is where the station tone will change. Suddenly the daughter will be like, oh God, why are you involving social services? So then you have to bring it. Well, Angela, first, or she might actually ask you directly, why are you involving social services? Do you think I'm abusing my mother? Well, I'm very sorry if I gave you that impression. You are a very caring daughter, as I told you. We don't know whether she is being abused or not, but that is one of the possibilities. Okay, so we have to make sure that she is safe, because at this age, if she gets injured, it could be very serious for her. Okay, and we don't want this to happen. All right. So, and also social services will be helping you to provide support to your mother. If you need any financial support or shelter, they will provide that. Okay, then she may agree that, okay, doctor, that's fine. So that is how the station will flow. So there is not much in the management itself, and that's also, you can just ask her in the later, does she need any more support? Is she, if she needs any support in coping up with the day-to-day activities, or any psychosocial history is bad, so you can also refer her to talking therapies. Maybe she have some anger problems or mood problems. Any questions? So this is how the elderly view station will run. So the mainly is data gathering. NAI history is very small. NAI management is very small. Don't directly jump into NAI. That is a small aspect, but the major aspect of this station. So first rule out the other causes of falls, medical, non-medical causes. Rule out the causes of bruises. Take Meptosa. Psychosocial history very important in all domestic violence cases. Don't forget that. Then in management, when you involve social service, that is the time. Then you have to change the tone. That why you are involving social services. And till then, don't give her the impression that she is to be the blame. She is the one to be blamed. Okay. Any questions?
Dr. Ruchit, yeah. What if, like you said, that after we mentioned the social services, the patient might the daughter might agree. What if she doesn't agree? Then how do we convince her?
If she
And
sorry, your
what
voice.
if she said no, she goes balance? If she says that why are you involving social services, and if she not agrees with you, then
No. She has to agree because we have to make her agree. So we will give her appropriate reasons why we're involving social services. So first reason is that we care for her mother. We wants to make sure that she is safe. And second reason is that it's for the daughter also it's beneficial because they will be providing a shelter, financial support for her mother. So she don't have to be worried. So she's just worried at this point. Okay. So she will agree with you. And also you have to tell like of course if you don't involve social services later on, let's say she pushes her mother again in future and her mother gets a serious fracture of spine because she's old, then she will be in trouble. Let's say she dies because somebody pushed her. So you have to tell her that at this age if she develops any injury it can be much serious for her. Okay, so it's very important that we have to make sure that she is not in any harm. Okay, so don't worry, all these things. Okay. All right. Any questions? Anything else? Okay. So we hope that domestic violence is care. Like you are more confident after this. I will be sharing the recording as well. Somebody texted. This was my question. When she go work, how come she no mother fell down? Thank you for the. When she go to work, how would she come? How come she no mother fell down? So see this is thing. So in this the story was that she was not there when the mother fell down, so mother has told her. Okay, or the story was that she lied that she was at work, actually she pushed her. So that is the truth, right? She pushed her, but she's making up that she was not there when the mother fell down. So let her say whatever she says in the history. Even if she says a lie, it doesn't matter. We don't assume whether it's a lie or truth. You just take her word of mouth. So it doesn't matter that how she came to know or what. Whatever she says, just ask her more about it. Ask other medical causes of falls. That's it. You don't have to dig deep. You don't have to do investigation here. You are not a police worker, okay? You are just making sure that the mother is fine and daughter has enough support. That's all your work is. You're not here to blame anyone. You're not here to accuse anyone. Okay, any questions? All right, so thank you so much for joining. Hope it was helpful. So we have, I'm again displaying this slide. We are starting on April 1st to April 5th. 2 slots are left and it will be detailed sessions, 100 stations in 5 days. We'll cover all the stations, whether it is ethics, counselings, teachings, medical stations, every topic will be covered. And we'll only go through the recalls from last 3 months, whatever are the most repetitive recalls. So hopefully if your exam is in like a month or next month, hopefully most of the stations will be repetitive for whatever we do in this 5 days. So if you want to go with it, please text me and so I can get you in the batch. Thank you so much. See you tomorrow. All the best.